Have you ever felt really anxious or stressed and had constipation or maybe diarrhea, stomach pain, feeling like, oh, I don't want to eat that, or I need to eat all of this? That's all being regulated by your serotonin. Serotonin has a major influence, both the secretions in your gut, so how you are digesting, as well as the motility. So how quickly are things moving through you, or how slowly are things moving through you? As well as pain reception locally to the gut. So if you're getting stomach aches every time you have anxiety, that's because of serotonin. Well, hello. Welcome back to the Medical Madam. Today we are talking about anxiety, specifically how the Microbiome-Gut-Brain Axis influences anxiety and what you can do to help reduce your anxiety.
Of the 4 most commonly prescribed medications for anxiety, 3 of them have one thing in common. See if you can spot it.
The number 1 most used medication for anxiety are benzodiazepines. An example would be Xanax. These medications are short-acting, so that means that they work pretty quickly. Within about 30 to 60 minutes, someone will start to notice the effects, if not a little sooner. The downside is that they don't last very long, and these are addictive medications. Benzodiazepines act on the GABA receptor. So they're different than the other medications used to treat anxiety. So GABA is pretty much the most potent inhibitory neurotransmitter in the brain, meaning that it helps the brain calm down. So benzodiazepines that work on the GABA receptor pretty much flip an off switch to say, whoa, let's calm you down. This is one of the reasons why benzodiazepines have a bit of a sedating effect and will oftentimes really help to pull someone out of like a panic attack. The other medications that are used for anxiety are not going to be helpful if you're having a panic attack, but a benzodiazepine probably will help you. The second most common medication used to treat anxiety are SSRIs. So these are selective serotonin reuptake inhibitors, and these essentially block the reuptake of serotonin at cellular junctions so that higher levels of serotonin stay in your brain for a longer period of time. So essentially it's increasing your serotonin level. An example of an SSRI would be Prozac. The third most common type of medication used to treat anxiety are SNRIs. So these are serotonin and norepinephrine reuptake inhibitors. So they block both serotonin and norepinephrine. A good example would be Cymbalta. The fourth most common medication is a little different. It's an antihistamine medication called hydroxyzine. So hydroxyzine works differently. Because it's an antihistamine, it's blocking histamine. And histamine is very stimulating to the brain. So essentially what it's doing is it's decreasing the overall activity in the brain. And by decreasing the activity in the brain, we're decreasing the reuptake of serotonin, therefore leading to higher levels of serotonin sticking around in the brain. So it's kind of like a backdoor way to increase serotonin.
That's right, it's serotonin.
Our microbiota produces hundreds of neurochemicals that our brain uses to regulate basic physiological processes. One of these neurochemicals is serotonin. Serotonin's biochemical name is 5-hydroxytryptamine, and this is abbreviated 5-HT. Serotonin helps to regulate mood and attention, our behavior, our libido, our blood flow and body temperature, wound healing, our digestion and GI motility, and even just the basic function of breathing. So in this video, we are really focusing on anxiety, but I just wanted to point out that serotonin does have a lot of local actions on the GI tract, including the development of the enteric nervous system. So this is the nervous system within our gut. It impacts motility, so how fast or slow food and bile and all that moves through you, which is basically going to translate into how often are you pooping and what is the consistency of your stool, as well as inflammation specific to the GI tract.
All right, so taking a look at what's happening here, tryptophan, which is an essential amino acid that you're getting in your diet or maybe you're supplementing with, about 95% of that tryptophan is actually going to go to a different pathway. So a very small percent is actually going to go towards being turned into serotonin, first of all. Second of all, this whole process here, the conversion of tryptophan into 5-HT, is happening in the enterochromaffin cells. So these are highly specialized endocrine cells in your intestinal tract. And so these are going to convert tryptophan into serotonin. In order for this to happen, you have to have this enzyme called tryptophan hydroxylase. There are two forms of this, and specifically here we're looking at type 1, and that is going to convert tryptophan into 5-HTP. The reason your gut microbiome has such a big effect on your serotonin level, it's not because the bacteria themselves are making serotonin, it's because they play a critical role in your production of tryptophan hydroxylase 1. So if you have a low amount of bacteria in your GI tract, you're going to have low amounts of tryptophan hydroxylase 1, which means you're not going to be able to convert tryptophan into 5-HTP, and therefore you won't be able to get high levels of serotonin. As you will hear as we go throughout this video, there's also a big difference between supplementing with tryptophan and 5-HTP, which are both advertised as supplements to increase serotonin levels. If you are someone who has a deficiency in this enzyme, in this rate-limiting enzyme here, taking tryptophan is not going to increase your serotonin levels because you can't convert it. You need 5-HTP. It's also important to note here that no step in the body can get done with just one thing. For this first step, we need iron, magnesium, calcium, vitamin B6, and B9. For the second step here, we need vitamin C, B6, zinc, and magnesium. And remember, we need healthy gastrointestinal cells and obviously a healthy microbiome.
All right, let's look at another mouse study. So this study took some mice that had a germ-free gut, so they didn't have a microbiome established, no bacteria in their gut, and looked at what was going on with serotonin. So they found that these mice had a significant decrease in the amount of enzyme present that would turn 5-HTP into 5-HT, which is serotonin. So they had a decreased capacity to actually make serotonin, but their catabolism rate of serotonin, so the rate that their body was actually using serotonin, was the exact same. So they have a lower ability to make serotonin, but they're using serotonin at the same rate as anyone else. So they're going to become deficient real fast. So then this study used those germ-free mice and gave them 5-HTP, the precursor to 5-HT, serotonin, and looked at the colon of the mice. So what was going on now with the serotonin? And they found that all of the side effects of not having enough serotonin were gone. So these mice had the proper expression of serotonin now from receiving 5-HTP. They also did this with L-tryptophan, the amino acid that gets converted into 5-HTP and then into 5-HT, right? But there was no increase with L-tryptophan. So L-tryptophan was not effective at actually increasing serotonin levels. So the study moved on and took mice that had a gut microbiome, so they actually had some bacteria present, and they gave them antibiotics. So now they're going to kill the bacteria that are there. And what did they find? They found reduced levels of serotonin after the antibiotics were given. And the longer period of time that the antibiotics were given, the worse that became. So the more deficient in serotonin they became, and the more symptoms of serotonin deficiency those mice had. So what are some of the take-homes of this? Your microbiome matters tremendously when it comes to anxiety and depression, but we're focusing on anxiety here, right? So you need to feed your microbiome. And what do the microbiome like to eat? If you watched my last video, you know the answer to this. Fiber. Your microbiome want fiber from fruits and vegetables, okay? So please eat fiber every single day. You also want to avoid antibiotics, right? Because antibiotics kill your microbiome. Obviously, if you need antibiotics, you should take the antibiotics. If you're taking antibiotics once or twice a day, you can take